When Congo announced its first coronavirus case, all the details from the health ministry about the patient were wrong, drawing a rebuke from the presidency and highlighting the challenges the huge African country will face if the virus spreads. A health ministry spokesperson initially announced on Tuesday that a patient who was Belgian and had been detected at the airport was in quarantine in Kinshasa's Kinkolo suburb. The ministry later said that the patient was in fact a Congolese citizen returning from France and had contacted the health services 2 days after his arrival in Congo and was quarantined in the Njili neighborhood. Concern over the virus caused panic among doctors and patients at the hospital, where the patient was quarantined to leave the facility. Street vendors on the streets of Kinshasa have also identified a market to exploit.
I'm selling masks because the coronavirus arrived in Kinshasa. When I started this morning, I had a good quantity of masks, but they have gone really fast. Now the place that I buy them from increased the price. So now it is 1,500 francs instead of 500.
According to patients, doctors have also given in to fears of contracting the coronavirus.
They were supposed to operate my son last Tuesday. And on Tuesday, the doctors told me they could not operate because the first case of coronavirus had arrived from Paris to be hospitalized here. I didn't believe what this doctor was telling me. Then on the same day at around 8 p.m., other patients started leaving the hospital after hearing this news about coronavirus. That is when I realized it was serious. Even the doctor stayed outside and didn't want to touch the patients.
I had an operation on my intestines because I got typhoid, but the operation didn't work. So the doctors organized for me to have a second operation. On the same day and then at the same place, I was due to have my operation. The first case of coronavirus was transferred here. So the doctors said they would not be working because they were scared.
Journalists in the DRC have also expressed concern over the way government disseminates information and updates over the deadly outbreak.
A serious government should be more reassuring because until now, we just have rumors. I even listened to Dr. Muyembe, who talked as if we hadn't confirmed the very first case. The minister is trying to make this epidemic a private issue, so much so that he is hiding certain details.
According to three ministers speaking on condition of anonymity, DRC President Felix Tshisekedi admonished his cabinet, saying that the health ministry had acted in an appalling and mediocre manner in dealing with the virus.